This video will review the Dentka pretreatment records and how to select the appropriately sized Dentka tray. The Dentka starter kit contains upper and lower trays with removable pins in small, medium, large, and extra large sizes. It also contains easy tracers, which will be used to simplify capturing an accurate and predictable centric relation record. The Dentka lip ruler measures the patient's lip drape, providing the necessary information to the Dentka software to determine ideal incisal display. Finally, the Dentka jaw gauge simplifies the measurement of the patient's vertical dimension of occlusion. Other necessary materials are typical for standard dental procedures, making it easy to incorporate Dentka into your practice. The required materials are high and low viscosity polyvinyl siloxane, bite registration paste, a slow speed handpiece with acrylic burrs, and a scalpel with a sharp blade. With these materials, everything is ready for the first Dentka visit. As with conventional dentures, first establish the vertical dimension of occlusion, or VDO. Traditionally, any number of methods have been used to measure VDO for a new set of dentures, including placing a dot on the nose and chin and using a tongue depressor to measure and record. The Dentka jaw gauge helps make recording this measurement simpler and cleaner with easy-to-read numbers. If the patient has current dentures with an acceptable vertical dimension of occlusion, as in this patient's case, they can be utilized as a guide for the new dentures. To capture VDO, have the patient seat their current dentures. Rest the patient's chin gently in the chin cup of the jaw gauge. Have the patient gently close into occlusion and slowly slide the ruler towards the patient's nose until it lightly touches the lower border of the nose. If too much pressure is applied, the patient's nose will move. Record the number when it just touches the nose. This number is the patient's VDO. If the patient has no dentures, or the current dentures have an incorrect vertical dimension of occlusion, it will be necessary to first establish the patient's vertical dimension of rest, using any standard technique, including having the patient say Emma, or licking their lips and relaxing their muscles. Subtract 1 to 5 millimeters from this vertical dimension of rest to allow for freeway space to determine the patient's VDO. The next step is utilizing the Dentka lip ruler, which helps establish final incisal display. Identify the premaxillary area of the patient's ridge, locating the incisive papilla. There is a cup-shaped portion at the top of the gauge that will rest in this area. Have the patient relax their lip and read the first visible number. Record this number on the lab slip. This number will be inputted into the software to determine incisal display. Dentka tray selection. When choosing a Dentka tray, there should be a relatively even space of about 1 to 2 millimeters all around the tray for even distribution of impression material. This is the ideal thickness for polyvinyl siloxane to be its most accurate. If the patient has an existing denture, it may be used as a gauge for tray selection. The inside of the tray should be roughly the same size as the patient's denture. In this case, the denture is tried inside the blue and green trays, and both are much larger than the patient's denture. When the green tray is tried in the patient's mouth, it impinges on the patient's soft palate, making the patient uncomfortable. In addition to patient discomfort, too large of a tray can lead to too much bulk of material, resulting in distortion and ultimately an inaccurate interocclusal record. A more appropriate tray for this patient is the orange medium tray, which is roughly the same size as the patient's upper denture. If a small white tray is used, the borders of the tray hit the tuberosities, preventing a complete seat. If this were used for final impression, there would be a large amount of unsupported, light viscosity polyvinyl siloxane on the borders, which could result in distortion, as well as a very thick bulk of material in the palatal area. As previously discussed, this could affect interocclusal records. Once you have chosen your ideal tray, you are ready to proceed with upper and lower impressions.